Hello. Today we will be discussing the abdominal and pelvic muscles. Let us begin by doing a simple review of definitions regarding origin and insertion. The point of origin refers to the most proximal attachments of the muscle attached to the bone that stays sedentary. Insertion refers to the most distal attachments of the muscle attached to the bone that allows for movement. Let us begin by discussing the transversus abdominis. There are 4 points of origin for the transversus abdominis. First, the inner surfaces of the costal cartilage of ribs 7 through 12. The next origin point is the thoracolumbar fascia, which is between the iliac crest and the 12th rib. The anterior 2/3 of the iliac crest and the inguinal ligament, as well as corresponding iliac fascia, are also origin points for the transverse abdominis. The insertion points for the transversus abdominis are the linea alba, abdominal aponeurosis, pubic crest, and pecten pubis. It is important to note that both the pubic crest and pecten pubis are inserted by the conjoint tendon. There are 2 main actions of the transverse abdominis. First, bilateral contraction, which compresses the abdominal viscera, and second, unilateral contraction, which can be defined as rotation of the trunk. Next, we have the rectus abdominis. There are 2 points of origin for the rectus abdominis, the pubic crest and the pubic symphysis. Both are attached by 2 tendons. One tendon attaches to the pubic crest, and one tendon attaches to the pubic symphysis. There are also 2 points of insertion for the rectus abdominis. First, we have the costal cartilage of ribs 5 through 7, as well as the xiphoid process. There are 3 main actions carried out by the rectus abdominis muscle. The rectus abdominis facilitates the flexion of the trunk and allows for the tensing of the anterior wall of the abdomen, as well as helps with core stability and balance. Next, we will demonstrate exercises related to the rectus abdominis. The first exercise being demonstrated is a standard forearm plank. It is recommended to hold this position for 30 to 60 seconds. Next, we have a free weight exercise called the seated Russian twist. To ensure safe practice of this exercise, be sure to use only a small amount of weight while maintaining a straight back and keeping the hips hinged at a 45-degree angle. Another exercise for the rectus abdominis is a simple mountain climber. A high resistance band was used in this video to create more tension, giving the rectus abdominis a better workout. Again, while doing this exercise, be sure to keep the back straight. This will prevent injury. Lastly, here is a machine exercise demonstrating how to work out the rectus abdominis. The machine being used is called a crunch machine. It is recommended to do 3 to 4 sets of 12 to 15 reps with a low weight. Next, we will discuss the internal and external oblique muscles. The origin of the external obliques is on the external surface of ribs 5 through 12. This is where the external obliques connect to the bone to anchor to the body. The insertion point for the external obliques is at the anterior or frontal portion of the iliac crest, or more commonly just known as the hip bone. The external oblique muscles also have a connection to a white sheet of fibrous tissue called the abdominal aponeurosis. The external obliques lastly have connection to the linea alba, which is also a blanket of fibrous tissue. The linea alba runs down the middle of the abdominal wall to the base of the sternum and to the top of the pelvis. The entirety of the external oblique blankets the internal obliques on both sides of the abdomen, which we will review again at the end. Next, we will discuss the internal obliques. There are 3 points of origin for the internal oblique muscles. The first point of origin is pertaining to the internal obliques is on the anterior or frontal portion of the iliac crest, or more commonly again known as the hip bone. The second point of origin is the iliopectineal arch, a thick band of connective tissue that connects to the iliac crest. The third point of origin is the thoracolumbar fascia, which extends on the posterior side of the body. The thoracolumbar fascia is a large diamond-shaped segment of connective tissue that separates the paraspinal muscles from the posterior abdominal wall. The internal oblique muscles also have 3 points of insertion. The first point of insertion are the inferior or lower surfaces of ribs 10 through 12. The second point of insertion is the linea alba. The linea alba is a blanket of connective tissue that runs down the middle of the abdominal wall to the base of the sternum and again to the top of the pelvis. The third and last insertion point for the internal oblique muscles is the pubic crest and pecten pubis, which are both portions of the hip bone. The external and internal obliques share the same functions when it comes to action and movement. The flexion of the vertebral column, which draws the thorax downward. An example of this would be bending forward. The rotation of the vertebral column, which can be described as rotating of the torso region. And lastly, the lateral flexion of the vertebral column is when the abdomen is compressed. An example of this could be described as leaning to your left or right and reaching to the outer portion of your knee. Next, we will review some exercises that work out both the external and internal oblique muscles. First, we have a simple body weight exercise. These are called external oblique crunches. It is recommended to participate in a higher number of reps with little to no weight for this exercise. Next, we have another body weight bearing exercise. This is a sit-up to twist, which works the internal oblique muscles. It is again recommended to engage in a high number of reps with little to no weight for this exercise. In this demonstration, a heavy resistance band is used. This is called a side bend using band resistance. The heavy resistance band is going to create more tension, which is going to engage the internal and external oblique muscles. Be sure to keep your hand on the head as to not obstruct the muscle. Next is a heel tap crunch with wrist weights. Used in this demonstration are just 1 pound of weight on each wrist. For this exercise, you would only want to use minimal weight with a high number of repetitions to work the oblique muscles. Be sure to keep your shoulders off the ground while you're doing this exercise and reach for those heels. Lastly, we have a machine exercise. This exercise being demonstrated is an oblique cable twist, which works both the internal and external oblique muscles. This does involve using weight, so it's suggested to use a lower level of weight while engaging in higher level of repetitions. Next, let us move on to the pelvic muscles. The iliacus major is located in the pelvic region and it connects the pelvis to the femur bone. The iliacus major has 2 points of origin, one being the iliac fossa, which is a large, rounded surface of the pelvic bone, and the second point of origin is at the iliac crest, which is the bone that you feel when you put your hand on your hip. It is important to note that the fibrous tissue runs downward towards the hip and combines with the psoas major to form the iliopsoas tendon, which inserts onto the lesser trochanter. The lesser trochanter is a round projection below the head of the femur. The principal actions of the iliacus major are flexion of the thigh, and similarly, the muscle also causes the trunk to move forward against resistance, which results in the same decrease in angle between the trunk and thigh that would occur during the flexion of the thigh. Next, we will discuss the psoas major muscle. Unlike the iliacus major, the psoas major originates on the spine rather than the bones of the pelvis. There are 3 points of origin for this muscle. There are origins on the lateral slender processes of the lumbar vertebrae, as well as the vertebral bodies T12 through L5, and lastly, the intervertebral discs. As mentioned already, the psoas major converges with the iliacus and ends on the lesser trochanter of the femur. The main action of the psoas major is the flexion of the trunk and the thigh. In addition to this, the psoas major muscle is also involved in rotating the thigh laterally, as well as lateral flexion on the trunk. Lastly, the psoas major stabilizes the vertebral column due to its origin on the spine. Let us review some common exercises and a stretch used for the psoas major muscle. In the first demonstration, this is a simple stretch flexing what we call our hip flexor muscles, which are the iliacus and psoas major. Be sure to just go on one knee and then you'll gently rock forward to stretch that hip flexor. Next is an example of supine knee pulls. You're going to want to use a medium to heavy resistance band and then attach it to something that's not going to move. In this example, we used a table leg. You're going to loop your foot through the band on the bottom. Pull your knee upwards and towards your trunk, causing flexion at the joint. Lastly, if you have access to machines, one can perform a captain chair leg lift. This is a great exercise to engage in the training of the iliacus and psoas major muscles. Be sure to maintain a straight spine and try to lift your legs up to create a 90-degree angle at your hip. Finally, in review, this diagram provides a very good overview of the way that the abdominal muscles are layered. The most superficial muscles are the external obliques, followed by the rectus abdominis, internal obliques, with the transversus abdominis as the most deep muscle, with the fibers of the transversus abdominis running east to west. Lastly are our reference pages for our photos and information.